So the next session will be on operative surgery and specimens. And operative surgery and specimens, they are separate sessions, and each of them will carry uh, 20 marks each. So again, it's a big session. So all you need to do is to have a certain idea regarding how to properly say talk about either operative surgery or the specimen that you are exposed to. So in this talk, what I am going to tell you is about the common problems that is kept for you, common operative surgery procedures kept that will be you should be thorough with, and also how you should be ready with the answers. That is the idea. I'm not going to tell you about exactly about all the steps of each operations, which will be discussed later, but at least you should be ready with common operation in this approach. And whenever you are given a specimen, you describe the specimen in an adequate way and also have be ready with the discussions. So, in operative surgery, the commonly when you are asked about operative surgery, you will be given a lot to decide. So let it be any surgeries, let it be any operations you're going to come across. Please describe that in a systematic fashion. I was taught years ago by Professor Varma that is whenever you're given an operation, please describe it thinking about this mnemonic. Pulling a patient in theater can cause complications. So you must be wondering what it is. Here, these are pulling means preoperative preparation. A is anesthesia. P is the position of the surgery. Patient for surgery. I is the incisions made. T is the technique. C is the closure. And the other two C's are the care and the post-operative complications. So if you can describe any surgery based on that fashion, that will have an impact on your presentation to the examiner. So always be aware that you should be systematic in your answers. So you may be asked about different operations like hernioplasty, thyroidectomy, modified radical mastectomy, tracheostomy, Trendelenburg operation, superficial parotidectomy, circumcision, intercostal tube drainage, gastrostomy, colostomy, version TV sac. What will be the thing? Be systematic in your approach. You say if it is hernioplasty, talk about, or thyroidectomy, which is a common surgery, talk about the preoperative preparation, right from basic investigations, ENT consultation, anesthetic checkup, preoperative day fasting, preoperative medications, and then consent. Then when you talk about anesthesia, the A, it is a general anesthesia with endotracheal tube. P is the position. Position is patient on the supine position, neck extended by pillows between the shoulder blades and the head resting on a pillow. Head into the table is elevated 15 degrees. So like that, you try to describe each operations and be very ready with the answers, because if when you say that, that answer has got a structure, and that is what all the examiners will be looking for. So these are the common surgeries for undergraduate exam that you should be aware of. Now, just to take it further, if I'm the examiner, I'll be just testing your further operative knowledge. I'll be giving you some pictures and asking you or asking you to draw certain reconstructions to know your further level. For example, if this is a picture, I will ask what is the operation for this. This is a Billroth 1 reconstruction for a gastric ulcer, benign gastric ulcer surgery. Right. Now, I can show you this and ask. This is a Roux-en-Y reconstructions. Then you will be asked about, you will be shown the surgery and the steps of the surgery may be shown, and you will be asked about what is this operation. What is this operation? This is a laparoscopic fundoplication for gastroesophageal reflux disease, the Nissen fundoplication. So that gives you an idea, or that gives examiner an idea whether you are a good student or an exemplary student. And this surgery, this is a surgical reconstruction following Whipple. And you will be asked about what are the anastomosis that is commonly done. That is the pancreaticogynostomy, choledochogynostomy, and gastroduodenostomy. And if you know it, it is very well. Even if you don't, nobody is going to fail you. But the knowledge of that is always helpful, because that will help you to add on to the marks you are going to get. So different types of examiners use different techniques, but basically all examiners are going to test what you know. It is not at what you don't know. So be very cool and just approach the exam as it is. And these are various type of gastric reconstructions after gastrectomy. You've got a Billroth 2 on the top and the Roux-en-Y reconstructions on the lower side. A is Billroth 2 and B is the Roux-en-Y reconstruction. So like that you can be asked about various surgery, esophageal surgeries. You already had a question on esophageal surgery for your theoretical exam. So like that you can have questions on the picture based questions sometimes on the different types of esophagectomy like Ivor Lewis, McEwan, the Oringas or the video assisted thoracoscopic surgery. So when you're asked to describe what is the surgery done on this patient with an abdominal incision and the left neck incision, you should be thinking about an esophagectomy done by an Oringer's technique, because that is that. So it shows that you are a student above the normal level. So basically you should know almost all common conditions, common surgeries, and examiners will be keen to know how much you know about it even in a short time, because it's easy to judge your level of knowledge just by giving one surgery and exposing you to different sort of things. So basically that is all you need to learn in operative surgery. What is this surgery? There is anastomosis of the bile duct to the duodenum, that is choledocho duodenostomy done for large CBD stones, recurrent CBD stone, residual stones, and so those are the primary biliary stones. You do choledocho duodenostomy. Now, lateral pancreaticojejunostomy is an operation done for chronic pancreatitis known by the term modified Paddington procedure. Basically, that is for chronic calcific pancreatitis. So, operative surgery is basically testing your knowledge, surgical knowledge, not in depth. You don't have to. You are not surgeons in the already gastrosurgeons or any endocrine surgeons or breast surgeons or anything. All we want to know is, have you seen at least one surgery, or are you aware of basic surgical workup? So that is all what is being tested. So please learn it in a systematic way. So whenever you get a question, please answer it in a systematic way as well, right? So that is about operative surgery. Now about specimens. Specimen can be anything. People, you can have specimen from anywhere. So what I'm giving you is only some clues. It is not that is or all colleges all the same specimen, but basically all surgical units will have some set of specimens, and you are asked to describe about various aspects regarding that. And the specimens commonly are thyroidectomy. So you'll be asked about thyroidectomies, the complications of thyroidectomies, how will you differentiate pathologically different types of thyroid swellings. I think it is well known to each one of you. Then what is this? This is a total gastrectomy specimen, and what you see whenever you are describing a specimen, always say whether it's a dry specimen or a wet mounted specimen. If it is in water or if it is dipped in the formalin, say it's a wet mounted specimen. If it's a dry specimen, talk about it as a dry specimen. So this is a dry specimen before being mounted, immediate after surgery. You can see a diffuse thickening of the stomach all throughout. And what is this diffuse thickening due to? That is due to malignancy, isn't it? That is the entire stomach is involved, and that is Lionitis plastica. So you will be asked about Lionitis plastica and different types of stomach tumors. Now, what about this endoscopic appearance? You get multiple polyposis. What is the condition causing multiple polyposis? The condition causing multiple polyposis is familial adenomatous polyposis. So you should know about familial adenomatous polyposis, and there may be some questions based on that. Now, what is this? That is a orchidectomy specimen, and what you see an homogeneous cut section specimen. It is a wet mounted specimen, cut section specimen of an orchidectomy, and what you are seeing is the cord structures and the testis, and the entire testis is filled with a homogeneous mass lesions with small septa in between, and there is somewhat like a bolt up here. And this is typical of a seminoma, isn't it? So the questions will be on seminoma and the testicular tumors. Now what is this? You can see the ileum. you can see the right colon and the cecum, and you can also see the right half of the transverse colon. So what is it? It is a right hemicolectomy specimen. If you look carefully, you can see you can very well see a mass lesion here, isn't it? So that is second for a carcinoma of the colon. You are doing a right hemicolectomy. So if I'm the examiner, I'll be asking about what is right hemicolectomy, what are the structures removed, what are the vessels ligated. So you should know the anatomical basis of right hemicolectomy. And if it's a carcinoma colon, some surgeons will ask you about the tumor marker, the staging, the Duke staging and all if they have time. But basically you have to say this is a wet specimen of right hemicolectomy showing ileum, cecum and the distal, the proximal of the transverse colon with omentum, and there is a growth which is extending almost up to the serosa on the ascending colon, and there are, whether there are lymph nodes or not there, that is what is to be described. Now, what about this? This is a gastrectomy specimen, right? This is a one is a total gastrectomy specimen on the left, and the second one is a distal gastrectomy specimen. And you know what all questions you can anticipate. You can anticipate any question you'll be asked about anything. There are it is well labeled there, but all you don't have to know as an undergraduate about all those things. You'll be asked about gastric cancer, the morphological types. Sometimes you'll be asked about the Borman's classification. How will you differentiate early gastric cancer and advanced gastric cancer? You will be asked about what is distal gastrectomy, what is total gastrectomy. All these things can be asked. Right, not in depth. What is this? This is a Paget's disease, isn't it? It can be a mastectomy. This is a clinical specimen, clinical patient, but you can have a specimen even with a Paget's disease, and you will be asked about the classification, Paget's disease, how will you treat Paget's disease, and the staging. This is again a clinical specimen of a lymphangiosarcoma in a post-mastectomy patient. You know what is it called? It is called as a Stewart-Travers syndrome, and it is a complication of a mastectomy. Now, what about this? This patient has got a thyroidectomy, and you can see two well-defined nodules, right? And if the next picture you see, there is a osteolytic lesion on the bone. And there is an osteolytic lesion on the bone. What will be your diagnosis? Your diagnosis will be follicular carcinoma with metastasis. What is this? This gentleman has got pigmentation, perioral pigmentation, and if I give you some clues, you will be very well versed with the diagnosis of Peutz-Jeghers syndrome. So that is it. Now that is an Einham. That is again a condition which is described as a vascular occlusive disorder affecting the toes and leading to autoamputation. And the treatment of Einham is Z-plasty before the onset of the disease. And there are few endoscopic pictures which I wanted to show you. This is gastroesophageal junction, and you can see it has been advanced proximally. The adenomatous epithelium has advanced proximally to the esophagus, a small island, and that is called as Barrett's esophagus. So you can be asked about questions of Barrett's esophagus. That is a Mallory stare, and on the left, and then the esophageal veins is on the right. This is a colonoscopic appearance, again a typical appearance of a transverse colon. I don't think you need to know it now, but at least at the next level, even for exams, the coming exams in the future, you should know. This is again an endoscopic appearance where you can see outpouchings from the sigmoid. And what is the condition? That is a diverticular disease. So you should know about it. Then if I'm an examiner, I will definitely keep this chart. I will label it and ask you to identify the percentage of burns. And I'm sure that all students should know how to identify the percentage of burns both in adult and in children, because that is a basic concept you should know. Right. Now about histology. This is a very rare nowadays. Nobody keeps histological picture, but some few histological pictures I just want to skim through one or two. This is a Paget's disease patient, and this is keratin pearls, where you can see the keratin pearls. Where do you get keratin pearls? In squamous cell carcinoma, and you can be asked. So anything can be asked. Basically, in operative surgery and specimens, the questions need not be just confined to that. It can go deviated to different side. But if you start confidently and if you say emphatically, this is a specimen, this is what I expect, naturally you are getting half the marks, and the rest of the marks are added on. So be confident, be cool, deal well. I'm sure you all will, and all the best. best for the exams coming up, and I will be adding on more and more videos on this regard. So please listen to that in the medical college YouTube channel or my personal channel. Thank you.